Hello and welcome to Good Life, the health show with me, Pooja. Well, viewers, discussion on COVID is being witnessed now and then everywhere. From COVID cases to COVID treatment, and now when people have started taking vaccination, it is being seen that everybody is coming forward and fighting against COVID-19. Well, viewers, today I am being joined by Dr. Tirupati Eye, cardiologist from Apollo Hospital, Guwahati, and Dr. Mehzabeen Rahman, eye surgeon from Tirupati Eye Hospital, joining us from Noida to have a fruitful discussion and try to touch upon various aspects related to COVID. So first of all, I'll come across to Tirupati Eye. Thank you so much for coming to our show. So, Tirupati, as many questions have been arising regarding COVID, but right now, which is the first and foremost and the myth or the question and the fear psychosis is among the people regarding the black fungus. We will touch upon everything. We'll touch upon the vaccination process also, but let's talk about a bit about black fungus. What it is all about. Is people have to panic so much at this point in time?
Yes, there have been a lot of panic situation we have been observing in the recent days, that what is black fungus, whether it is communicable or non-communicable, how does it happen, is it a killer disease? So this kind of, so there are a lot of panic attacks going on all over, particularly in the northeastern region. And then I just want to convey certain statements is that this is actually a non-communicable disease. And this fungus can grow in human bodies only when that particular person or that particular patient is severely immunocompromised. So the immunity, if it is severely depressed, it is because of some existing diseases. The patient might be having diabetic, patient might be having some maybe a cancer patient on immunosuppression medications, or patient taking steroid for a long time, like in COVID patient. We've been giving steroid to this group of patients for a longer time. So these are some unprecedented situation only when the immunity of the particular individual is severely depressed. Then only that fungus infection can grow in the human body.
So what we have learned is immunity plays a very important role regarding whatever we are talking about black fungus. So immunity plays a very important role. So if a patient's immune system is very less, so the chances is more. So we'll come across to you again. We'll go across to Mehzabeen Rahman joining us from Noida. So Mehzabeen, the same question I put to you as well, talking about black fungus, which is also very much in these days. People are having sleepless nights. What exactly it is? Our people have to be worried about it. So as you are there in Noida, several cases have been coming up. So what is your take on this?
Hi, am I audible to you?
Yes, you are totally audible. So if you have heard my question, so please proceed with that.
Yeah. So first of all, thanks for inviting me to the show. So there is nothing to be afraid of this black fungus. Like my esteemed colleague has said, only those with very low immunity, they are susceptible. This fungus, mucormycosis, is found everywhere in the environment. But only those people with very low immunity might be affected by it. Others, please do not panic. And that's all.
All right, so others do not have to worry, but people are actually getting worried about it. So we have two doctors present in our show, and they are there. And viewers, numbers are flashed on your television screens. This is a live program. So if you have any queries regarding anything regarding COVID-related topic, so you could please call up and ask your questions. And doctors are here to help you out and clear all your queries at this point in time. So Dr. Tirupati, coming to you again. So low immunity, one part of it. So if we talk about this mucormycosis, so we have also heard a case in the Apollo Hospital, and so is it related to fatalities whenever a person is detected with black fungus? What is the casualty rate on that?
Yes, there is official release and report on that the case has been detected, and it was a severe rhinocerebral form of mucormycosis, and if this kind of disease occurs in human body, a majority of the patient die. And because first, the most important aspects of the treatment modalities is that we have to detect it early. and it needs debridement, and there is some antifungal infection suggested for this kind of infection.
All right, so it has to be detected early. So, Ritupana, if it is detected early, so what is the process? How do you go ahead with it? How are the doctors planning to take the treatment about it? But it is actually very rarely found, isn't it?
It is very rare disease, in fact.
And it is found in the patients who are admitted in ICU. We have just heard about it, and it is a clear statement by the Health Ministry also out there today itself. So, all right, we'll talk about it, but we have a caller waiting for us. So let's take the call first, and we'll proceed with the conversation. Hello.
Hello.
আমি শুনি আছো আপোনাৰ প্ৰশ্নটো কৰিব
এইটো ব্ল্যাক ফাঙ্গাস আপনার সিম্পটমস কি হবে না
black fungus symptoms. So person is asking about black fungus symptoms.
There are various symptoms, black fungus, there are different forms. So it can involve the skin, it can involve the organs, basically retroorbital, and then the sinuses there are some air spaces in the this facial region, and that can be infected, and it can infect to any organs, and it can and predilections for cerebral brain.
You can reply him to his convenient and audible language as well, as he has asked in Assamese, so it will be comfortable for him as well. So we are talking about
I'll
black
try
fungus.
to translate in Assamese.
Yes.
So body যিকোনো organs involved হ'ব পাৰে, আৰু স্কিন ইনভলভমেণ্ট হ'ব পাৰে, চকুৰ পিছফালে ইনভলভমেণ্ট হ'ব পাৰে, ব্ৰেইনৰ ভিতৰত ইনভলভমেণ্ট হ'ব পাৰে, অৰ্গেন ইনভলভমেণ্ট হ'ব পাৰে, এণ্ড ইট অলছ' ইনভলভছ ব্লাডৰ যিবোৰ ধমনী থাকে, শিৰা থাকে, চ' শিৰাৰ ভিতৰত গৈ ব্লক কৰি দিয়ে, আৰু তাৰ ভিতৰত কিছুমান ক্লট, মানে ব্লাড ব্লক কৰি দিয়ে, আৰু তেনেকৈ সেই অৰ্গেনছবোৰ ডেমেজ কৰে. ইটছ ভেৰি ডেডলি ডিজিজ, আৰু মেজৰিটি অফ দি পেচেণ্ট সাকাম টু ডেথ.
All right, so I'm sure the viewer who have just asked the question must be noticed and must be benefited with the answer just a doctor gave. So, Mehzabeen, coming to you again, you are there in Noida and treating some patients as well. So, what is the number of cases you have got through regarding black fungus, and what you have to say at this point in time to our viewers?
Okay, over the last 2 weeks, we have had 6 cases of black fungus. These people, they were already admitted for COVID in ICU. They have been released from the hospital, and now they have come to us in the eye hospital with redness, with discharge from the eyes, and also sinus involvement. But
Alright,
all
so
of them are like
these are
severe
the
cases.
after effects when a person is detected by a black fungus, isn't it?
Yes, absolutely.
All right, so what is the treatment process, and how do you assure the person that the things will be worked upon it, and what are the remedies and what are the treatment do you start with first?
Okay, first of all, most important is the correct diagnosis.
Okay.
Because the person has been in ICU for a long time, it can be other infections also. To rule out that it is indeed black fungus or mucormycosis, we have to do a nasal endoscopy. Nasal endoscopy, then we'll have to send it for microbiology examination.
Okay.
After that, if it comes out to be mucormycosis, that is black fungus, we will immediately start the person on amphotericin B. Amphotericin B will continue it for 2 weeks. Then slowly, depending on the results, we will convert him to posaconazole, which is a oral drug.
All right. Thank you so much, Mehzabeen, and stay with us. Ritupana, coming to you again, cardiologist, being a cardiologist, so cardiac complications also come up if a person is detected with COVID. So what are those cardiac complications do you come across, and what would you like to tell our viewers?
Cardiac complications, if we talk about the numbers, so there is myriad of cardiac complications.
Okay.
And we can start with, for example, it can involve the arteries. You know, the arteries that supply blood to the heart muscles. So it can involve the arteries. It can cause inflammations there.
Okay.
It can directly involve the heart muscles also. It can cause inflammation in the heart muscles, the muscles to be weaker. And then patient will develop the signs and symptoms of heart failure, like shortness of breath, then unable to lie down, and then there will be edema. That means the fluid accumulation in the bodies. And also it can involve the lungs. So you know the lungs, and lungs is connected by through heart means some blood vessels. So it can form clot in that particular blood vessels, and then we call it pulmonary thromboembolism. That means clot inside the pulmonary.
Related. Okay.
So it can involve various parts of the heart and the lungs. That it can involve the blood vessels. It can involve the heart per se also, and also it can involve the conduction system of the heart. That means the system that is generating the heartbeats. So the patient might come to the clinical OPD with low heart rate, or some people can come with a fast heart rate. So there are different types of manifestation of COVID that is involving the heart.
All right, we'll come to that again. We have a caller waiting for us. Hello.
Hello.
আমি শুনি আছো আপোনাৰ প্ৰশ্নটো কৰিব
মানে কোভিড হোৱাৰ পিছত মানুহ বহুত উইক হৈ যায় তো পোষ্ট কোভিড মানে প্ৰপাৰ ডায়েট কিবা তেনেকুৱা আছে নেকি কি খালে আৰু ইমিউনিটিটো মানে কোভিডৰ পিছতহে বেছি উইকনেছ দেখা গৈ আছে এতিয়া
All right.
Should I answer?
Yeah. Rituparna, please first you go ahead and I'll ask Mehzabeen to do the
কোভিডৰ সময়ত actually কি হয়, there is hypoxia হয়, body oxygen কমি যায়, and that is the main reason that we feel very fatigue. And also it can involve different organs involved কৰিব পাৰে, lung, heart, liver, anything. And also one important is that we need high protein diets. So protein diets is recommended post-COVID, there's convalescence, there's recovery phase. So the proper nutritious diet, fruits and vegetables, and also the high protein diets are actually recommended.
All right. So, Mehzabeen, if you have anything related to that, if you want to tell our viewer and the caller who just asked question, post-COVID, what kind of diet should be followed regarding post-COVID questions were asked just now. So, what would you like to tell?
Post-COVID diet you're asking about? Okay, so post-COVID diet is basically a high protein diet, and that's like more of nutritious vegetables and fruits to be added.
All right. Thank you so much for calling at this point in time and sharing your thoughts. But numbers are flashed on your television screens, viewers. So if you have any queries regarding the COVID and regarding whatever you want to ask regarding COVID, regarding vaccination, black fungus, which is people are getting a sleepless night at this point in time. So doctors are here to help you out. And please call up and ask your question. But right now, we'll slip into a short break. But do come back soon because we have lots more on the other side. Welcome back, and you're watching a Good Life, the health show with me, Pooja, and we are having a fruitful discussion on different topics related to COVID, be it vaccination, black fungus, or whatever you want to ask, and the numbers are flashed on your television screens, viewers. So if you have any queries regarding that, please call up and ask a question. Dr. Rituparna, coming to you again. So we were talking about cardiac complications regarding the COVID situation. So if we talk about the vaccination process, which is right now on, people are coming out in large numbers and taking vaccines. So is there any cardiac complication after vaccination if a person has taken a vaccine?
Yes, there is certain evidence, and some data are there, particularly mostly in the European countries, because following the Covishield vaccinations, so there is chances of clot formation. So, and it is mainly involving the brains. So brain blood vessels are getting clotted. So we call it the cerebral venous sinus thrombosis. And so there are certain complications following the Covishield particularly. But after the Covaxin vaccination, no such report has been so far gathered. So this type of clot formation can happen following the COVID vaccination, like the Covishield.
Okay, so clot formation has...
But one thing I just want to emphasize here, that the chances are extremely low. Even if following the Covishield, if there is chances, as if we talk about the chances of following Covishield vaccination, what is the chance of clot formations? Though it is very rare, it is very uncommon also. So we no need to be panic for that.
Because nowadays people are very conscious about things, and they of course search many things on internet as well, and they follow social media as well. So they must have also heard about this clot process regarding Covishield, which you have just mentioned. So is anyone have to worry at this point in time after taking Covishield shield, or be it after taking the vaccination, that one would generate that clot which you're talking about at this point?
Yeah, if we talk about the incidence following the Covishield vaccination, so it is less than 2 per million population. So the chances are extremely rare, extremely uncommon. So I just want it to be very prudent for the society, is that we should not be too much of panic on that.
So one should not panic about things, and if you have any queries, you must also approach doctors to get those answers to be cleared, isn't it?
Yes.
Because if you search a lot on internet, you will get a lot of information on that, and of course you might get confused about it. But the things which we are mentioning in our show is that, be it regarding vaccination, one has to come out and take vaccines on a proper time, and regarding the time limit has also been extended now by the government.
Nowadays it is extended.
Yes, so it has been extended by the health department as well. So will it fall any impact on the person who has already taken the first dose, and the impact on the second dose will be taken, because the time limit has been breached now?
Yes. The important is that how much this protective antibodies form in that particular individual following the second dose of vaccination. So if we delay the second dose, so the chances of immunity that developing in that particular individual is higher. So that is why. So previously we thought about that we keep the gap a month. Then we gradually increasing the gap to 6 to 8 weeks. So now it is more delayed. So means that we want to get more immunity, more protective antibodies in that particular individual.
Okay. So this is just
so
because...
this is all based on certain studies, certain data.
Studies which is ongoing, and its studies are going on, so people are, and the authorities are getting note of it, and how things are being taken process, because the time gap has been extended. People are having that questions also in their minds. So why is the time gap now been extended? So later on they won't say that, oh, you don't need a second dose. So these things and this situation won't arise, isn't it, doctor? So if we talk about the pulmonary circulation, it also does it also cause a clot in the pulmonary circulation?
Yeah, you know that the lungs are the pulmonary, that we call the pulmonary. These are the purifier. So and it is connected by heart through some blood vessels. So what happens? So these blood vessels that flowing through the lung or that pulmonary segments, so it might get clotted. So it can be direct impact of the COVID infection. So that is why we give blood thinners for it.
Blood thinner. So role of blood thinner is very important.
Yes, it is very important, particularly in COVID situation, and because the COVID directly involved is blood vessels and can form clot. So to prevent clot formation, we give it different forms of blood thinner. We call it heparin, we call it enoxaparin. So sometimes we give some tablet forms of blood thinners. So these are extremely important as a treatment modality in COVID infection.
You also mentioned about the steroids being given to the patients as well. So are every patient being able to take that? Because we also have heard about the heart attacks. So does it cause heart attack, or what is the thing all about?
In COVID infection, because it causes inflammations and enhance immune reaction. So to suppress that, we give steroids, and for the lung to resolve quickly, also we give steroids. But another caveat of is that those patients existing cardiac disease or recently having heart attack, so we need certain time gap, like 6 weeks, maybe 8 weeks time for healing of the heart. So if we give steroid in that recommended doses in those particular patients, existing cardiac problem or had recent heart attack, so the heart healing process may be delayed. That is why we consider to modify the dose of the steroid in those particular patients who are having recent heart attack.
All right, so that has to be taken note of it, because lots of cases are emerging at this point in time. Lots of patients are there, and doctors are doing a commendable job at this point in time. So we would like to tell our viewers that the numbers are flashed on your television screen. So Dr. Ritupana Borua is here in our studio, and if you have any queries regarding the topic which we have taken today, please call up and ask your queries, because if you have any little confusion in your mind regarding the vaccination, one should go out, one should go and take vaccine or not. So please get that doubts clear at this point in time. So doctor, how can one reduce those complications and deaths among under 45 patients? Because it is a part of a job, but at least depending on the situation and depending on the criteria of the patient, it is very important, isn't it?
Obviously, prevention is the main motto of this the whole pandemic situation. So
all right, doctor, we have a caller waiting, so let's take the call first. Hello.
Hello.
Hello. হেল্ল'
হেল্ল'
আমি শুনি আছোঁ আপোনাৰ প্ৰশ্নটো কৰিব
হয় নমস্কাৰ মই সঞ্জীৱে ক'লোঁ ওদালগুৰিৰ পৰা
কওকচোন
হয় মই ছাৰৰ পৰা জানিব বিচাৰিছিলোঁ বৰ্তমান এই ক'ভিড চিটুৱেশ্যনৰ সময়ত আমাক যিখিনি ভেকচিন দি থকা হৈছে তো ভেকচিন মই বৰ্তমান ফাৰ্ষ্ট ড'জটো ল'লোঁ বাট এতিয়া ছেকেণ্ড ড'জটো বা কেনেধৰণৰ সেইটো আমি ফৰ্মেলিটি আমি গম পাইছোঁ কিন্তু ফাৰ্ষ্ট ড'জটো লোৱাৰ পিছত যিখিনি শাৰীৰিকভাৱে অলপ অসুস্থতা হয় তো সেইটো মানে হ'লে কিবা মানে বেছি কাম দিয়া বুলি জনা যায় এইটো বাৰু কিমান দূৰ সত্য বা কিমানখিনি সঁচা হয় সেইটো বিষয়ে অলপ জানিব বিচাৰিছিলোঁ
অলৰাইট
মানে আপুনি জানিব বিচাৰিছে ভেকচিনৰ পিছত যে মানুহৰ কিছুমান ফিভাৰ বা তেনেকুৱা ধৰণৰ চিমটমছ হয় সেই বিষয়ে
হয়
চ' সেইটো একচুৱেলি ভেকচিনটো দিয়াৰ পিছত বডিত কিছুমান ইমিউন ৰিয়েকশ্যন হয় হ'ব পাৰে চ' বাট মেজৰিটি অফ দি পেচেণ্ট 95% আই কেন টেল ইট দিজ আৰ মাইনৰ ৰিয়েকশ্যনছ চ' লাইক ফিভাৰ হ'ব পাৰে বডি এক হ'ব পাৰে বডিত ষ্টিফনেছ নিচিনা ফিলিং হ'ব পাৰে বা চৰ্ট টাইপ এনেকুৱা ধৰণৰ চিমটমছ হ'ব পাৰে বাট মেজৰিটি অফ দি পেচেণ্ট মানে মেক্সিমাম পেচেণ্টৰে কি হয় জাষ্ট পেৰাচিটামল আপুনি এটা বা দুটা ড'জ ল'লে আপুনি ভাল পাই যাব এণ্ড ইউ টেক ৰেষ্ট ইউ টেক গুড নিউট্ৰিশ্যন ইউজুৱেলি 2 পৰা 3 দিনৰ ভিতৰত এনেকুৱা ধৰণৰ চিমটমছ যদি ডেভেলপ হয় সেইখিনি ঠিক হৈ যায় ইয়াৰ কাৰণে আমি বিশেষ চিন্তা কৰিব নালাগে কিন্তু যদি পেচেণ্টৰ বেলেগ ধৰণৰ চিমটমছ হয় লাইক চেষ্ট পেইন হ'ল বা হেডেক হ'ল বা চিভিয়াৰ উশাহৰ কষ্ট হৈছে খুব বেছিকৈ উশাহৰ কষ্ট হৈছে বা তেনেকুৱা ধৰণৰ যদি খুব বেছিকৈ চিমটমছ হয় তো ইমিডিয়েটলি আপুনি এজন ডক্টৰ বা ফিজিচিয়ানৰ লগত আপুনি কণ্টেক্ট কৰিব লাগিব কথা পাতিব লাগিব
All right. Thank you so much for calling at this point in time, and I'm sure you must be benefited with the answer just the doctor gave. So, Mehzabeen, you are there as well. Mehzabeen, as you have been also treating and treating the patients out there in Noida. So, if we talk about the situation there, how things are worst or good or whatever you want to say at this point in time, how is the inflow of patients coming in every day in your hospital?
See, Pooja, I work in an eye hospital. So over the last
we were
couple of
talking
days,
about this black fungus cases
Yeah.
only. After that, if people are
Yeah.
coming and taking a note that how things can be taken forward. So I'm talking about those patients as well. What is the inflow of patients in your hospital for those checkup?
One thing I'd like to say is a lot of people are coming with conjunctivitis. In
Okay.
Assamese, it is called, eye flu, Joy Bangla. Conjunctivitis is a symptom of coronavirus. So I ask people to be extra careful, to go to the doctor and just have a look into their eyes, whether this is normal conjunctivitis or it can be a symptom of coronavirus, COVID-19. Now coming to the question that you are asking, so initially there was a huge surge of people coming with eye diseases related to COVID. Over the last 2 to 3 days, the peak has already been reached, and now the population has decreased. The COVID population luckily, it has stable, but now we are getting news that in rural areas it has spread like wildfire. So from cities, it is now spread to the rural areas, and hence the COVID situation is bad in the rural areas.
All right. All right, Dr. Ritupana, last words at this point in time. What would you like to tell our viewers, because we are really short of time?
The first and most important is that the preventive strategies we should always adopt that we have been taking. So the use of mask, use of hand sanitizer, these are extremely important. And also the mass vaccination, so that we should always follow it. And the third point is that we should not be too much of panic on this, whatever the black fungus or white fungus, whatever the terminology has been coming today, and it is spreading like wildfire. So we should be more scientifically oriented. We should read about these things, and I'm trying to emphasize more and more that the black fungus is a non-communicable disease, and it happens only in a severely immunocompromised patients. So these are my last note in this interview.
All right. Thank you so much, Dr. Ritupana, and thank you so much, Dr. Mehzabeen, for joining at this point in time in our show. And thank you so much, viewers, for joining us. And with this, we have come to the end of the show. And we hope that we were able to answer all your queries in the best possible way. So stay healthy, stay fit, and keep watching Northeast Live. Goodbye.